I maimed, injured, and devastated my patients and their life in the operating room. My name is Christopher Duntsch, or Dr. Death. I came into this world on April 3, 1971, in a small town in Ohio, to loving parents who instilled in me the values of hard work and determination. From an early age, I displayed a keen interest in science and the human body. Fascinated by the intricate workings of the brain, I knew that I wanted to dedicate my life to medicine, specifically specializing in neurosurgery. With a heart full of dreams and a thirst for knowledge, I set out on a path that would shape my destiny. Early in my tenure at Baylor Plano, I made a poor impression on my fellow surgeons. Dr. Randall Kirby, an experienced vascular surgeon, remembered how I often boasted about my abilities despite being new to the area. However, my skills in the operating room left much to be desired. In fact, according to Dr. Kirby, I struggled to even wield a scalpel effectively. Unfortunately, several of my surgeries at Baylor Plano resulted in severe harm to the patients. One such patient was Kenneth Fennell, my first surgical case at the hospital. Due to my mistake, Fennell experienced chronic pain as I operated on the wrong part of his back. He later underwent a second operation by me to relieve the pain, but it left him significantly paralyzed in his legs. Fennell endured months of rehabilitation to regain some mobility, but his life was forever changed. Another patient, Lee Passmore, suffered from chronic pain and limited mobility after I made multiple errors during his procedure. I cut a ligament that should not have been touched, misplaced hardware in his spine, and placed a screw in the wrong location. I even stripped the threads, making removal impossible. Vascular surgeon Dr. Mark Hoyle, who assisted me during the operation, was so disturbed by my actions that he physically restrained me and warned me directly about the danger I posed. He questioned my sanity as I seemed oblivious to the significant bleeding that occurred. Barry Morguloff, the owner of a pool service company, experienced a similar fate. During his surgery, I left bone fragments in his spinal canal while attempting to remove a damaged disc. Initially, I refused to provide him with pain medication, wrongly labeling him a drug seeker. As a result, Morguloff lost most of the function on his left side and became wheelchair-bound. Even my longtime friend, Jerry Summers, fell victim to my incompetence. Summers came to Plano for a neck fusion, but I botched the procedure, rendering him quadriplegic. In a second surgery, I further constricted his spinal cord by packing it with an excessive amount of gel foam. Summers lost a dangerous amount of blood during the operation, but I refused to acknowledge any wrongdoing. My alleged drug use on the eve of his surgery raised concerns among hospital officials, and while I passed a drug test, they placed me on leave pending a peer review. Although I was cleared to resume operating with restrictions, Summers remained a quadriplegic until his death, ultimately caused by complications from my operation. Another tragic case involved Kelly Martin, who underwent a routine back operation that I turned into a catastrophe. I severed her spinal cord and an artery, causing massive blood loss. Despite warnings from colleagues and the clear signs of distress, I persisted with the surgery, hindering the efforts of the ICU team to save her. I ignored her deteriorating condition and even stayed in the ICU waiting room writing notes while she went into hemorrhagic cardiac arrest. Kelly Martin tragically bled to death. Upon discovering my failures to meet their standards of care, Baylor Plano officials permanently revoked my surgical privileges. They initiated a peer review, but rather than face certain termination, I chose to resign. In an attempt to avoid legal battles and potential loss in a wrongful termination suit, the hospital reached an agreement with my lawyers. I was allowed to resign, and in return, Baylor Plano issued a letter stating that there were no issues with me, thus avoiding the obligation to report me to the National Practitioner Data Bank. The consequences of my actions were severe and irreparable. Lives were forever changed, and the pain and suffering caused by my medical incompetence cannot be undone.